As we found out with the research from economists and also scientists of public health, that mental health is such a big part that actually is not well addressed, that it is now given to our country teams and to national and regional teams to think how they can introduce this in the current ongoing policies. I think one best practice that we found was the case in Rwanda. As you know, after the genocide, the country was really overall traumatized. At that time, European Commission was not, I think, active in the specific field of mental health, but other bilateral corporations were supporting the Rwandan government that decided not just to go to a humanitarian aspect only of mental health issues, but to a systemic approach. And so they decided to have a policy to train all staff and to train also specialists, so that the whole system at the first line entrance can recognize better mental health issues, treat them if possible in place, refer them to the community if it's better to be dealt with in the community, or refer them to higher specialized services in hospitals or in specialized centers where then psychiatric specialists can deal with the problem. And this has been started about now 20 years ago, and the example is working not only for the country, but we became aware that in the sub-region, neighboring Burundi and neighboring Eastern Congo are exchanging, so that there is a kind of peer-to-peer exchange on an experience in one country that benefits a region. During a study that we funded to find out what's already ongoing in the European Commission's work, we found out that in the delegations sometimes much more was already done than we were aware of here in the headquarters and for different reasons. So, for example, in Afghanistan, as you can imagine, from the burden of disease in the sense of trauma and post-trauma, there was an activity that was already set up within the Afghan health system that was supported by European funding. And we found another example that was presented last Thursday in Guinea, that had started on a very grounded community basis and then spread out to other health centers and communities, that was initially co-funded by the European delegation in the country. So that's the way it started. And with the findings of the research project that we presented, the Emerald project, we made a video conference with delegations that were interested, and they are interested because they will try to build in this in the policy dialogue with the country, and through this dialogue come perhaps later on to measures that can be supported, at least to end up that mental health finds its place in the health systems dialogue. And one concrete case has already started, that the researchers from the Emerald project are in dialogue with the Zambian government to look concretely how this can then come to a programmatic policy decision.